My name is Dr. Hillel Mazansky, and I'm coming to you today from San Diego, California. My areas of expertise encompass medical hypnosis and hypnotherapy, guided visualization, nutrition, and exercise. Please read my new book titled Empower Yourself with Medical Hypnosis, available on Amazon.com, and if you do, you will live a longer, happier, healthier life. Today's health tip is titled, What is Fibromyalgia? Fibromyalgia is a chronic condition that affects approximately 5 million Americans. Doctors diagnose the condition according to the patient's history and the physical examination. Patients experience pain and stiffness in the muscles, but X-rays and other specialized tests fail to reveal any abnormality. While the disease does not actually affect the joints or the muscles or organs, the constant aching can have a significant effect on the daily lives of people who suffer fibromyalgia. The symptoms of fibromyalgia are fatigue, sleep problems, anxiety or depression, and specific tender points on specific places throughout the body. One of the unique aspects of fibromyalgia is, as I mentioned, tender points in specific locations of the body. When these areas are touched or pressed upon, patients feel the pain. While people without the ailment, all they feel is pressure when you touch those areas. There are 18 possible tender points which are located in the neck, arms, and pelvic region of the lower back. The pain of fibromyalgia is real, and it can be intense at times. Some patients feel that, open quotes, it's all in the head, close quotes. We physicians believe that the pain is actually real. Females between the ages of 25 and 60 have the greatest risk of developing fibromyalgia. Females are 10 times more likely to develop fibromyalgia than males. After the pain, fatigue is a debilitating symptom. It is like feeling utter exhaustion. The patients may feel tired early in the morning after many hours in the bed. The fatigue can interfere with daily activities at home and in the workplace. There are many theories why fibromyalgia develops, but research has yet to find a clear culprit for the illness. Some doctors believe hormonal or chemical imbalances in the brain can cause the disease. Chronic stress may also increase the person's susceptibility to fibromyalgia. Constant fighting of the pain can cause irritability, anxiety, and depression. Exercising can go a long way in helping the symptoms of fibromyalgia. The diagnosis of fibromyalgia is made by the history and physical findings of the tender spots. Tests may be done to exclude other causes of similar complaints, mainly of the pain and the fatigue. There is no specialized test that can be done to diagnose fibromyalgia. The triggers include cold or humid weather, too much or too little physical activity, stress, and poor sleep. Many people with fibromyalgia suffer from insomnia. They have difficulty falling asleep and awake frequently during the night. Studies prove that sufferers remain in a shallow state of sleep and never experience deep, restful sleep. Nearly 1/3 of all people with fibromyalgia suffer depression. Some research believes that the depression is due to the chronic pain and fatigue. Others believe it is due to abnormal brain chemistry. The goal of the treatment is to minimize the pain, sleep disorders, and mood disorders. Over-the-counter medication drugs may be used, as well as the so-called NSAIDs. Antidepressants such as amitriptyline and Cymbalta and Lyrica may help, but these are fraught with side effects. Exercise can help manage fibromyalgia symptoms. The physical activity reduces the pain and improves fitness. Walk approximately 20 to 30 minutes 6 days a week, walking at your normal pace and then increasing slowly thereafter, and this can go a long way to improve the complaints of fibromyalgia. The exercise helps reduce the fatigue and depression. As far as diet is concerned, some researchers believe that there are certain foods and food substances that can aggravate the symptoms, such as tomatoes, caffeine, aspartame, and MSG. Some research reveals that massage therapy may be of great benefit to reduce the symptoms of the pain and the pressure. Rubbing, kneading, and moderate pressure can lead to the success of massage. Acupuncture, formal studies have shown that acupuncture have mixed reviews. Some people find that acupuncture helps, while others do not. Fibrofog is a term used with patients who have difficulty in concentrating. To help with fibrofog, you should write notes about things you need to remember. Keep your mind active by reading or by doing puzzles. Stress appears to be a common trigger factor for fibromyalgia fog. Try and reduce all those things that induce stress in your life. While this might be sometimes difficult, it will, however, go a long way to reduce your symptoms of pain and fatigue. Yoga, meditation, guided meditation, and relaxation techniques all help. Last but certainly not least, medical hypnosis and hypnotherapy goes a long way to helping patients with fibromyalgia. On my website, drmedicalhypnosis.com, is a hypnosis video for fibromyalgia, stress, depression, and insomnia. I invite you all please to visit the website and download those that you feel are appropriate for fibromyalgia. If you do, you receive complimentary weekly telephonic calls from me on an ongoing basis. My name is Dr. Hillel Mazansky, and I thank you for listening to this health tip.